Welcome back. Today we're on your side with how you should treat acid reflux and when you should seek a doctor's help. Right now we have Dr. Michael Passarella. He's a gastroenterologist. I knew I was going to get that one messed up. Gastroenterologist? Nope.
Gastroenterologist.
Close.
Yep.
I got it. All right.
Yep.
With Shelby Baptist Medical Center. It's Monday. Bear with me. So we've been talking in the commercial break about acid reflux. A lot of people suffer from this, but for people who don't maybe know what it is, or if they have it and don't realize what it is, what is acid reflux?
Yeah, so acid reflux is a condition in which the acid in your stomach, which is normal to have, which normally helps break down your foods and digest your foods, actually can reflux into your esophagus or your food tube that carries food from your mouth to your stomach. And when that happens, it can cause symptoms we're all familiar with. Burning, heartburn, it can cause some chest pain or chest tightness that you mentioned before the commercial break. It can even cause some pain in your stomach and bloating and many different symptoms.
And are there any things that you should do to, I guess, treat it at home, or things you should avoid eating if you find yourself dealing with those symptoms pretty often?
Right. There's many different foods and things that can trigger acid reflux, and everybody that's experienced has probably identified some of those. But there's common ones like coffee, chocolate, alcohol that you can probably avoid to help.
Chocolate?
Yeah, chocolate
really?
included. Yep, that's
okay.
right. Too bad, huh?
But that's not fair.
And then other things you can do, you can lose weight, you can stop smoking if you smoke, and we tell patients, you know, if you have nighttime reflux while you're laying down, you can raise the head of your bed 6 to 8 inches, which might help some. But generally speaking, there's some good over-the-counter medicines that might help if you have intermittent symptoms that are not too bad. But if your symptoms are persistent or seem to be getting worse or don't really respond well to all the things I just mentioned, that's when we recommend seeing your physician, because there are some good medicines and medical therapies that we can try initially generally, and then there's some testing that might need to be done as well.
And that's what I was going to ask you. So there's first medicine and then changes to your diet and your lifestyle, but if you do have to seek a doctor's assistance, help, treatment, what are some of the treatments that treat acid reflux in a hospital or a doctor's office?
Right, so generally speaking, as I mentioned, the first line generally is going to be medicines that you can either take over the counter or be prescribed, and then the lifestyle modifications that I mentioned. But in some cases, if you don't respond to those things and you continue to have reflux, and if it's causing damage, you know, and inflammation in your esophagus or your food tube that I mentioned, there are surgical options as well. And that's when we get to that point in your treatment. We talk about maybe performing an endoscopy, which is what I would do, and we take a look down with a camera and a scope to see if there is any damage, and see if there's anything that we need to know about, and then potentially about the option of surgery, at which point we get you in with a surgeon and they can discuss those options with you as well.
If people have any other questions about the symptoms they're dealing with or about this condition, can they contact you at the office?
Yeah, absolutely. You know, we would be more than happy to see you in the office and go over anything that you have questions about or that you're worried about. And, you know, real quickly, I'll just touch on two, you know, alarming symptoms in which I want people to know that they should definitely go see their doctor. If you have problems swallowing, things not going down well, you know, your symptoms seem to be getting worse, or obviously any kind of bleeding or anything like that, you would want to contact your doctor right away.
Immediately. Okay, well, thank you so much, doctor. We appreciate your time.
Thank you for having me on.
Have a great week.